Hello, Placer community. I'm Health Officer Dr. Aimee Sisson, here to update you on COVID-19 here in our county. Placer County announced its first case of COVID-19 on March 2nd in a healthcare worker who was exposed in Solano County. On March 3rd, Placer County announced its second case of COVID-19 in a resident who became ill during a cruise to Mexico on the Grand Princess. The next day, that second case of COVID-19 passed away from their illness, marking a tragic milestone in the disease outbreak as the first death from COVID-19 in the state of California. Since then, we have identified 5 more cases among Placer County residents, all in passengers who traveled on the Grand Princess from February 11th through the 21st. A total of 7 cases have been confirmed in Placer County to date. Across California, we are seeing more and more community-acquired cases. Cases who are not sure how or where they became infected are community-acquired cases and mean that the virus is spreading in the community. Community-acquired cases have been identified in several California counties, including Yolo and Sacramento counties. Given the time that has now elapsed since the return of passengers from the Grand Princess and the large number of persons in the local community who may have been exposed to identified cases as they went about their daily lives while ill, we know COVID-19 is spreading in the Placer community. Community spread indicates that we are entering a new phase in the epidemic. Up until now, the efforts of the Placer Public Health Team have been focused on identifying persons with COVID-19, separating them from others, and tracking down persons who were exposed to the infected cases. This containment strategy has helped to slow the introduction of the virus that causes COVID-19 into our community, allowing time for us to prepare, but it is no longer effective given the large number of cases in the county and broader region. Public health must now shift its efforts to community mitigation measures. Community mitigation measures are approaches that will slow the spread of COVID-19 in our community, reduce the number of people infected, and protect those who are most vulnerable to severe illness. By slowing spread, these mitigation measures will allow time for the healthcare system to prepare additional resources and for production of a vaccine. The decision to shift from containment to community mitigation measures is being made after much deliberation and by weighing the potential benefits to the health of our community against the significant disruptive effects that these recommendations could have. I understand that these recommendations will have major impacts on the lives of people in our community. I am making these recommendations based on the best information I have at this time in order to protect the public's health. At this critical moment in the growing outbreak of COVID-19 in Placer County and the region, decisive action is needed to slow the spread of the disease. Other California communities have already transitioned to community mitigation measures. Today, we announced recommendations that will impact workplaces, schools, large gatherings, and healthcare workers, including first responders, and would be in effect through March 31st. Additional strategies may be layered on as needed to slow the spread of COVID-19. For workplaces, I recommend that workplaces and businesses should implement telecommuting for their employees, if this is feasible, and minimize the number of employees working within arm's length of each other. For large gatherings, I recommend that those who are planning large gatherings should consider modifying, postponing, or canceling them, especially if large numbers of people will be within arm's length of each other. For schools, I recommend that schools that have a COVID-19 exposure or case should make decisions about closing or other actions in collaboration with myself as the local health officer. Schools should also follow the joint guidance issued by the California Departments of Public Health and Education, as well as minimize the number of students and staff working within arm's length of each other whenever feasible. I urge all sick persons to stay home if they are sick until they have no fever, cough, or other respiratory symptoms for at least 72 hours after symptoms resolve or 7 days after symptoms began, whichever is longer. People with mild, cold-like symptoms should manage their symptoms at home with over-the-counter drugs whenever possible, regardless of whether they have a cold, the flu, or COVID-19. People who develop difficulty breathing, feel very tired, or were feeling better but then feel much worse should call their healthcare provider. If they go to the provider's office or urgent care center, they should call ahead so that the healthcare provider can be prepared to take care of them. People should only call 911 or go to an emergency department if they believe that their life is in imminent danger. Other emergencies are still occurring, and emergency resources must be available to address all of them, not just COVID-19. As I previously recommended, older persons and those with underlying medical conditions are at higher risk for severe COVID-19 disease and should consider staying home and away from social gatherings where people are within arm's length of each other. With the shift from containment to mitigation, it will no longer be necessary for someone who has been in contact with a case of COVID-19 to quarantine for 14 days. This applies to the general public as well as healthcare workers and first responders. However, persons with a known exposure to COVID-19 should monitor themselves for respiratory symptoms and fever for 14 days. If they develop symptoms, they should stay home in order to protect those who are well. Again, for at least 72 hours after symptoms resolve or 7 days after symptoms began, whichever is longer. Testing for COVID-19 is now available through commercial laboratories. However, just because a test is available doesn't mean that it is necessary for most people. People who have mild symptoms or are getting better do not need to be tested because their treatment will be the same regardless of the result. There is no approved medication to treat COVID-19. Testing is a decision made by healthcare providers to help in the care of very ill patients, as well as to protect public health. In addition to these new recommendations, I continue to recommend frequent hand washing, coughing and sneezing into a tissue or your sleeve instead of your hand, and cleaning surfaces more often. In the coming days and weeks, our Placer community must come together to protect the most vulnerable in our community. This is a challenging time, but we will get through it together. Thank you, and be well.